Hi friends, I am Dr. Shidhar Krishnan, MD, Consultant Physician. Today we will be discussing about the regulation of GFR. We know that GFR is regulated by intrinsic as well as extrinsic mechanism. It is the intrinsic mechanism that really comes into action. They includes myogenic, tubuloglomerular feedback. Second one is the extrinsic mechanism, that is the neural and the hormonal. Actually, intrinsic mechanisms acts locally in the kidney when the BP fluctuates from 80 to 180 mm of Hg. It helps you to maintain a nearly constant GFR over a wide range of mean arterial pressure. So it includes, remember, it includes the myogenic response, second tubuloglomerular feedback, and extrinsic mechanisms comes into action whenever there is a decrease in BP of 80 mm of Hg, when the mean arterial pressure goes below 80 mm of Hg. It helps to maintain the blood volume and the blood pressure. The two mechanisms that is acting in the extrinsic mechanism or the extralineal mechanism includes the neural, that is the sympathetic one, and the hormonal one. So the autoregulation helps you to maintain the systemic arterial beat fluctuations within a range of 80 to 180 mm of Hg. So coming to one by one, first is the myogenic autoregulation. What is happening here? Actually here, whenever you get a fluctuating BP or whenever you are getting an increased arterial BP, there is an afferent arteriolar blood pressure increase which stretches the arterial wall, and that stretching is sensed up by the myogenic stretch receptors, which will helps you to open the voltage gated calcium channels. And what happens now? The calcium is coming from the extracellular fluid to the vascular smooth muscle cells. There is influx of calcium. This makes the vascular smooth muscles to contract, and hence there is vasoconstriction. So what is this mechanism doing? It helps to minimize the changes in the afferent arteriolar blood flow, and also it minimizes the changes in the GFR. So that is how the kidneys regulate the variations in the GFR. Actually, myogenic mechanism contributes up to 50% of the total autoregulatory response, and it occurs very rapidly, reaching a full response in 3 to 10 seconds. And next one is an MCQ point. Remember that myogenic mechanism occurs only in the preglomerular resistance vessel because of the presence of voltage gated calcium channels. It is not seen in efferent arterioles, probably because of the lack of voltage gated calcium channels. So just remember a situation where you don't have an autoregulation. That person even can have a urine of 46 liters when the BP is rise to 25%. So here is the importance of myogenic or autoregulation. Very, very important internal regulation of the kidneys. So second one after the myogenic response is the tubuloglomerular feedback. So what is happening here? This is a specialized mechanism that is sensed up by the macula densa. So whenever you have an increased renal arterial pressure or a renal increased GFR, it can produce flow of fluid into the tubules. This is sensed up by the macula densa. And macula densa, actually it is situated between the thick ascending limb and the distal convoluted tubules. This will give some impulse to the glomerular apparatus, and which will produce afferent arteriolar constriction, and hence it decreases the GFR. So macula densa senses the flow dependent changes in the sodium chloride reabsorption. Again, the macula densa cells signals to the JG cells, but its mechanism is not well understood. And the mediators here are nitric oxide and adenosine. Actually, adenosine is a potent vasodilator, but it is this where it is the only site here present in the afferent arterioles where it has a vasoconstrictor action because of the A1 action. So what happens when the arterial pressure is reduced? When the arterial pressure is reduced, there will be increased glomerular filtration pressure, decreased glomerular filtration pressure, decreased GFR, and there is retention of the sodium and water in the PCT, and there is decreased delivery of the sodium at the macular densa. And this will again give signal to the afferent arteriole saying that nothing is coming here, just open up. So what happens? Resistance decreases and there is vasodilatation. And again I told you there is an impulse going to the JG cells which will increase the renin, increase the angiotensin II, and hence the afferent arteriolar resistance, and there is vasoconstriction of the efferent arterioles. So after the intrinsic response, next is the extrinsic response, of which neural regulation of the GFR is the first one. We know that the kidneys are supplied by the sympathetic fibers. It is both afferent as well as efferent arterioles are supplied. But during rest or when there is no stress, the blood vessels, the sympathetic activity is very minimal. But whenever there is sympathetic stimulation, initially both the afferent and efferent arterioles constrict equally. But when it is more higher sympathetic stimulation present, like exercise or hemorrhage, it is the afferent arterioles which have more receptors in that will have a profound vasoconstriction and it reduces the GFR. So next is the hormonal. There are a lot of hormonal factors that comes into action to maintain the GFR, of which the renin-angiotensin system is the most important thing. Remember, renin actually is, whenever the GFR is low, the renin is produced from the JG apparatus of the kidney. And renin, what does it do? It will convert the angiotensinogen to angiotensin 1 and 1 to 2 by the ACE. So the effect of the RAS is by the angiotensin 2 mainly. And the angiotensin 2 has mainly 4 actions. Remember that 4 actions. What are the 4 actions? Efferent arteriolar constriction, releasing aldosterone from the adrenal cortex, stimulation of the thirst center of the hypothalamus, and increasing the ADH. All this will increase the GFR. By efferent arterial constriction produce increasing GFR by the increased glomerular hydrostatic pressure. By increasing the aldosterone, it will produce increase in the reabsorption of the sodium. Increasing the stimulation of the thirst center, it can increase the blood volume. And increasing the ADH again produces the water reabsorption from the distal tubules. So this is how the renin-angiotensin system works. And coming to the next hormone, that is the histamine. Remember, histamine has both action. That is, by local action it can increase the GFR, and by contraction of the mesangial it can decrease the GFR. Dopamine, it can cause vasodilatation, can increase the GFR, and relaxes the mesangial cells. Coming to the atrial natriuretic peptide, a very important hormone, because as the name indicates, it can cause natriuresis and diuresis. How? This is by the dilatation of the afferent arteriole leading to the increased blood flow and filtration. It can produce a diuresis. Whereas natriuresis is by the suppression of the action of the ADH, and it will produce natriuresis. So this action is very important because many times in clinical settings like cardiac failure, you can have stretching of the atrial wall, releasing the atrial natriuretic peptide. The patient can complain of frequency of urination like that. So I think this is a hormone in patients with hypertension and renal failure you can administer because it can decrease the BP, and this is one of the hormones that can decrease the BP. So endothelins, it is a potent vasoconstrictor, can decrease your GFR. And next is the endothelial derived relaxin factors, that is endo. It can increase the GFR by your vasodilatory action. bradykinin, again a potent vasodilator. And next is the adenosine. As we have already discussed, adenosine is a constrictor of the afferent arteriole. Remember, this play a role in the tubuloglomerular feedback. This is produced by the kidney, and this is the hormone which has a vasodilatory effect in all other systems, whereas in the kidney, in the afferent arteriole, it has a vasoconstricting action because of the A2 action. Remember, this is an MCQ point. Many entrance questions have asked this point, so please note this. Glucocorticoids. There is an increase in the renal blood flow and the GFR. And coming to the last one, this is the prostaglandins. You know that prostaglandins is secreted by the kidney, and actually this masks the effect of catecholamines and angiotensin II and increases the renal blood flow, and this can also relax the mesangial cells, that is the PGE2. And this point, the importance lies in the shock, because in shock we know that when there is sympathetic activation, it can cause deterioration of the renal function because of the profound vasoconstriction. But overwhelming action of the sympathetic system is masked or prevented by the prostaglandins. So this protective effect is very important clinically also, because when you give NSAID and all in these patients with acute febrile illness, patient going for shock, there is high chance the patient can go for acute kidney injury. So you should use NSAID cautiously in such patients. So this is a very clinical importance in certain clinical scenarios. So this is the physiology here. So prostaglandins is a very important hormone in the maintaining the GFR. So if you don't have a prostaglandin, there is no protective effect of kidney from the sympathetic activation. So this is a summary of the neurohumoral control of the GFR and the renal blood flow. So thank you for your patient listening. I hope you all well understood the class. So if you like my presentation, please subscribe and share, and please press the bell button so that you all get more updation from me. Thank you.